Hello, my name is David James Smith, MD. I'm the Medical Director of San Diego Comprehensive Pain Management Center and Pacific Surgical Institute, a fully licensed and accredited ambulatory surgical center here in Metro San Diego. We also have locations in El Centro, California and Chula Vista. I'm double board certified in physical medicine and rehabilitation and pain medicine with an emphasis on interventional pain medicine. I've been in practice now over 28 years, and we provide outpatient interventions to treat chronic pain. Some of the advances in the last 8 to 10 years have revolutionized the treatment of chronic pain and spinal disorders. Previously, many of these disorders had to be treated with hospitalizations and required months of rehabilitation. Current advances allow us now to treat these same conditions with outpatient procedures. This allows you to return to function quickly and to get out of pain faster. I hope you enjoyed this digital video library that we have created that shows some of the more exciting advances in interventional pain medicine. Look for us on YouTube at San Diego Pain Center. Once again, I hope you enjoy these videos, and please feel free to contact us and check us out on social media as well. Thank you. This is a sacroiliac joint block, and this is done when patients have pain on either the right or left side of the low back along the sacroiliac joint, which commonly produces discomfort. So we've done our physical exam. I'm marking the right sacroiliac joint, which you can see, and then I'm going to clean it again with my chlorhexidine sponge, creating a sterile field. Again, using the sterile drape. This just helps prevent any infection and keeps us all honest. So now I'm drawing up my mixture for the right sacroiliac block. We also call these SI blocks. And I use Decadron, Kenalog, and Marcaine at 5% Marcaine. So I've got that drawn up. Now I'm anesthetizing the skin with lidocaine 1%. And I'm going to go down to the SI joint, take a picture, make sure I've got a good trajectory. And that looks perfect. So I'm going to go ahead and give a fair amount of this lidocaine as I pull back on the needle so that the patient doesn't feel any discomfort. And as you can tell, the patient is not uncomfortable. It's my practice to discuss with the patient while I'm doing everything. You may not be able to see it because of my mask, but I'm talking to the patient throughout the procedure. You probably noticed the tip of the needle was beveled, and that's so I can steer it. So now I've got it in the SI joint. I felt it enter the SI joint. And I'm going to put some Omnipaque in there to confirm that it is in the joint and spreading. So I've repositioned it. I did not like the spread, and now I'm happy with the spread. And you can see the entire sacroiliac joint has Omnipaque in it. And I think we have a picture at the end that shows that for you. So now I'm injecting my steroid and Marcaine mixture into the joint while I hold the needle. And you can see the patient is not uncomfortable because I've used lidocaine to numb it. Sometimes you have to go slow because the joint has to absorb the volume of liquid. And that's the sacroiliac joint. I think we got one last picture here for you to show the efficacy of that spread. And there's the SI joint and the Omnipaque spreading all the way up the length of the joint, confirming that we were in the right spot.